You mentioned the word power there. I'd love to swing back to that. Tell us how this all impacts on power dynamics, because it's one thing to not like somebody, but it's another for the power differential.
So racism without the power is just prejudice. And as you're right, we've all got a right to not like whoever we don't want to like. That's fine. The power dynamic is around who's actually making policies, who has got the power and who's impacted by that power. So I'll give you an example of that. If there's an Equalities Act 2010. It covers 9, I never can remember, 9 or 10 protected characteristics. Most organisations, and definitely most public sector organisations, have to have policies and procedures around that. It's the law. How that law is applied and how those policy and procedures are written and who they're written about will impact on how those policies are enacted, and that's the power. Who has the power? Who writes that? I was a director of a programme director of commissioning in a city, London Borough, and I know that the decisions that I made in a city borough were totally different because of my heritage and where I came from, and the people I talked to, and it was a fantastic CCG actually. They won awards for connecting with their population and asking them what they want, and they also won awards for working with their local communities and their community organisations. So they were really clear around the services they provided would be that the communities would be engaged and would have a say in those services, and it made such a difference. And I would say it's one of the best jobs I ever had, because I was able to use my personal and positional power to make a difference, but also listening to communities. I didn't always get it right, and since I've left there, I've had to reflect on that. So what was that all about? And and there was definitely something to be done. But the power, if you're designing services, who are you designing it for? I'm a nurse. I know in healthcare, and I know there's some healthcare people here, that there's healthcare services tend to be designed for the people who are delivering them, not necessarily the patients. They're delivered Monday to Friday, 9 to 5 in the main. And if you are a single working mother, you're going to be hard pushed to actually utilise those services. And that example's got nothing to do with race, but that's what I mean.
Talking of not always getting it right. Quickly, the difference between white saviour and white allyship.
So this is triggering. This is not triggering. It's difficult, isn't it? So I think in this kind of work, and the research shows that the people with power need to be part of the solution. Definitely. Brilliant quote I heard, which was from a writer who's written about race. It was like, don't ask me why I've not been invited to the party. You need to ask the host, really. So that is around, who's actually got the power there, because who's inviting people to the party. So it's really important that we involve everybody in the solution around this, because we're not going to get anywhere if we don't do that. But however, I think the key around doing that with impact, with great intent and impact, is to listen. It is to actually do your homework. Look, come to events like this. Say you're all great, you're all wonderful. This is great, and use the internet. Listen to people's stories. Ask questions. Think about what's coming up for you. Like, how do you feel about this increased focus on race? What did the Euros mean to you? What was that about? And why would people feel the way I do as opposed to the way you do? And how does that translate into the stuff you're doing at work or in your life? And and how can you help? And how can you help without dominating? How can you empower rather than dominate? So I think the greatest thing you can do, and I always say the greatest gift you can give anybody, is your attention, is to listen. What is it like to access your services? What does it feel like? What's the patient journey? What's the patient experience? And ask that questions. Do you have the right amount of data that you need, both quantitative and qualitative? And they're both really, really important, and you can make decisions based on that. And so hearing a person's story is really effective, and if you hear it more than once, that's data, isn't it, really? And then when people are making decisions, I'll give you an example from where I was talking about where I didn't get it as right as I wanted. I used to work in Hackney. It has a large Orthodox Jewish population, and we worked very closely with Orthodox Jewish population, very, very committed. But this population don't access services because of fears around their history and their heritage. They don't vote. They don't participate in state schools. They home educate. They self-educate. They've got different ideas around men and women, how they should act and what do. They don't partake in mainstream media. That's a whole different tip. And we really struggled to actually give them the services that they wanted to, and they told us the services they wanted to, and and I can't say hand and heart I got that right all of the time, but I did represent those views. But it wasn't just up to me, and could I have pushed harder? And when I actually had the choices to make those decisions, did I make the choice that was in their interest or in mine? So that's the sort of thing that you need to think about, because I did have the data, I did know what they wanted. So and I would say when asked, and did they get what they wanted, they would say no. So that's because we delivered our services in a very traditional way that didn't really reflect. However, I did work in a different service which was around continuing care for children, and we did a thing which was around personal health budgets, and we were able to get it right, and I was really proud of that because it was based around their family needs and not a hospital's needs. So it goes both ways, but it was a great lesson for me.
How much work do you think we have still got to do in terms of being able to successfully have a healthy collaborative approach between the communities that we're trying to help, and alongside the people in power, I guess, and our white allies? Do you think that we're on the right road to that, or what's your experience of that collaborative approach? Does it happen?
It can happen. I have seen it happen, but I've also seen it not necessarily happen. So a collaborative approach. So I'm going to give you a really good example of allyship. So this event is a really good example of allyship. Something designed to hear people's views, something that was co-designed, and thinking about the right approach. And you guys can tell us whether this is the right approach or not. To have a conversation rather than a lecture, to sort of like talk about experiences and feelings rather than talk about legislation and what should be happening, and to hear people's views and where they're coming from, to get people across in the health economy, in the health and wellbeing economy, to be here. I would say that an anti-racism pledge, and there's a difference between an anti-racism pledge and an equal inclusion pledge, or even equality pledge. It's quite deliberate and very, very welcome, and to have conversations like they've been having in Weston-super-Mare Council with different people in the community is fantastic to do. And also to be really clear about what your intention is. So all public sector organisations have to have an equality sort of policy, a diversity policy. I always say, because I used to look at people's policies, and I'll say, so what's the point of this policy? What are you trying to do, and how do you know it's successful? So in any of the things that you're doing, it's really important to know what does success look like, both for the organisation and for you as a leader, but also for the people who are experiencing that policy or that initiative. So So I'm going to use Weston-super-Mare as an example. So it's fantastic to have an anti-racism pledge. What do you do with that anti-racism pledge? So what you've decided to do is to have these events, to talk to people, to have those things, and at the end, I guess it's around so people will feel that something's being done. So what I hear, and I do focus groups with organisations. I also work with Black staff networks. Is that people feel that nothing's happening. So not only does justice need to be done, justice needs to be seen to be done. There needs to be an outcome, and something needs to be different, and something needs to be demonstrated.